So we're here with Dr. William Nudera in Chicago at the American Association of Endodontics annual session. And I wanted to start off, first of all, Dr. Nudera, just to find out what are you looking forward to at the annual session, either speakers that you've come to see or products that you know are going to be unveiled?
So the annual session for me is the pinnacle of the year. Not only do we get to see a lot of new products that come to market, some new ideas, new concepts, it's also a chance to share some ideas with colleagues, see old friends and meet new ones. A couple of things that I'm really excited about, or at least interested in, that are new to this show. Two specifically, something called a tomosynthesis product that is trying to bridge the gap between two-dimensional periapical imaging and cone beam, where it actually takes technology from the medical side of the house for mammograms and captures several two-dimensional images at various angulations, then has an algorithm that reconstructs it and allows you to move through the image without actually having to take a three-dimensional image at all. So it's a very interesting product. Mm-hmm. It's a new idea, a new concept with radiographic imaging, and I think that's something I'm really interested to see. Endodontics and cone beam are getting certainly more legs as time goes on, but those who aren't really on the philosophy of cone beam for cases yet, this is something that could bridge that gap. So that's very, very interesting. Mm-hmm. The other product or the other new concept that I am really excited to see, which I haven't stopped by their booth yet, is a company called SciAct. It's a product that's coming out with Sergio Kuttler and Anil Kishen. Anil Kishen is one of the top researchers in endodontics right now, and he's coming up with a lot of nanotechnology. And they've come up with some proprietary solutions, if you will, for irrigation. And the focus on endodontics moving forward is irrigation. And they're introducing something that may be an adjunct to, or even a replacement to, sodium hypochlorite. And that's something that I'm very, very interested in. So I'm for sure going to stop by and chat with them.
That sounds great, and thank you for sharing too. And then I was also just curious to what, if any, trends have you been noticing, say, in the last year or so with your patients or with endodontics in the U.S.? What kinds of things are you following and also bringing back to your patients?
So a couple of big trends that we've been seeing in the last year or two, maybe, a few years I would say. Number one, with patients. The biggest thing that we're seeing with patients, fractures. Cracked teeth. We're under a lot of stress, a lot of life events are occurring, and people carry stress in a lot of different areas, and we're seeing more so post-pandemic that it created a lot of issues with people clinching and grinding. Also, medications like something called serotonin reuptake inhibitors have a side effect called nocturnal bruxism. So all of these variables, anxiety, stress, medications, will create these circumstances of these irreparable or irreversible damage to the tooth, and we're seeing it manifest in pulpal disease and periapical disease. And it's becoming difficult to navigate through this, because once the tooth is damaged with a fracture, you can't fix it. So we end up finding ourselves managing and treating symptoms associated with a greater problem. So the trend we're seeing with fractures is something that probably needs to be addressed higher up the chain before it does become an issue with their teeth. But when it does, we're here to help. But long-term prognosis with these is a little bit more questionable. So that's something that we're seeing way more now than I have over the last decade and a half. Regarding technology and how it's affecting endo within the last few years is what we call the trend towards minimally invasive dentistry. Now that minimally invasive dentistry has been a buzzword for a long time. We're now starting to see it more come to fruition more with endodontics, with some of these more advanced irrigation systems, like something called the GeneWave system, lasers. And lasers have been around for a while, but they're getting sort of a resurgence here in endodontics as well with some of the newer technology. And we're able to shape less, we're able to preserve more tooth structure, and hopefully prevent those fractures that we're seeing in clinical practice.
Thank you.